Welcome to the Grow Your Practice podcast. Hi, I'm your host, Chad Madden, owner of Madden Physical Therapy and Breakthrough. Join me each week as we dive into the best practices, systems, principles, tips, and tricks to help you grow your private practice.
We are at the top of the hour here. We're going to get started. In this session, we're going to go over texting for profits. So if you've ever had any sort of lull in your marketing at all, new patient flow coming in, we're going to talk about how to solve that. And this is going to be a lot more simple than what you might think. There's a poll coming up on your screen. If you can answer in the poll, are you currently using texting, most likely to your past patient list, at your practice? So we have 55% yes, 45% said no. I mean, that's pretty typical, about half. Texting is a newer media, and I think there are a lot of unknowns. We're going to do a live example here and have some fun with this, but if you know how to use it the right way, it can be extremely successful for your practice. So what have you used for reactivations? If you have a patient list, are you sending direct mail, snail mail to them? Are you using email? Are you doing something else? If you're thinking about patients coming back in for additional care, how are you doing your reactivations? How are you communicating to your past patient list? Just answer that in the chat. And then one more question for you. How many reactivations did you have last month? We looked it up specifically for this call. Now realize we have 7 locations. A reactivation is a past patient who has been discharged. Now they're coming back to you for additional care. So it could be for the same diagnosis. So you saw Mary Smith for her knee 2 years ago, and now she's coming back in for her knee again. Or it could be for a different diagnosis. So you saw her for her knee before, now it's for back pain. Adeline says roughly 50%. So reactivations, we do a lot of work. We mail out over 20,000 newsletters each month. This is really the driver for our practice. And again, it's 7 locations, but combined, we had 181 reactivations on the month. So everything that I'm sharing here with you is not only data from my practice, but also the 200 plus practices that we work with currently today. So lots of data, lots of best practices. And again, you're going to walk away with something very simple that you can use for reactivations. And once you know how to do this, you'll be able to use it the rest of your private practice career. So how to get the most out of the day, quick housekeeping here. Grab something to write with and write on. I'll be sharing a handout here at the end. We'll get to that in a minute. But as you're going through, again, this is going to be a super simple process that you can always go to whenever you need new patients coming through the door. So you're in the right place if you have a patient list. You have the capacity to treat more people. I think it was Rodney, you had mentioned, not really having an initiative around reactivations, but people do reactivate. That's awesome. You're providing high quality of care and relying on word of mouth referral. It's even better when you can knowingly, with confidence, fill in the schedule. You have the capacity to treat more people. You have some open schedule time or open space, right? You're renting 3,000 square feet and you only have 2 clinicians in there seeing 100 visits a week, and you want to fill up your space. You want to increase your reactivations, right? You have people on your list who already know, like, and trust you, and you want to bring them back in. And number 4 here, you'd like to improve your payer mix. Very difficult to do if we're relying on physician referrals, way easier to do when we're doing this with reactivations. I don't hear too many people in the marketplace talking about this right now, but we can hedge our bet, hedge our efforts when we're reactivating. And I'll talk about how to do that here in a little bit. So my promise to you is in the next hour, I promise to give you a very simple and clear plan that you can follow to increase your reactivations through texting. You'll learn about a proven message to fill your schedules with your highest payers. The other thing that I'll give you here is a disclaimer. I am not a compliance specialist. We work with compliance specialists, Mary DeLong, Alicia at BCMS, and the rest of the BCMS team, Janie Flex, some others as well. So whatever industry that you're in, if you're behavioral health, if you're a physical therapist or podiatrist, whatever you might be, find the compliance person and make sure that you're compliant. That's really your responsibility. I'll show you the mechanism that you can take and apply. So when you put this into action, in the end, you're going to have more control and consistency over your new patient flow. And as I mentioned before, when you stay until the end, we have a template. I'll give you the template. It's a 10 text challenge template that you can take and deploy and use. So let's just talk about this. Regardless of your industry, where do new patients come from? The lowest hanging fruit is reactivations. So if you just thought about your clinic and you drew a 10-mile radius or however far people are willing to travel. So I'm here in Harrisburg, Pennsylvania at our original office, main office. If I draw a 10-mile radius, there are about 42,000 households, 100,000 people roughly. And who is most likely to come in as a new patient next month? So we're in May, and if we were looking ahead to June, who are the people that are most likely to come in? Well, we know there's more than a 50% chance that that person is already going to be a past patient, right? That's the lowest hanging fruit. So we can't possibly reach out to everybody and have a one-on-one conversation with all 100,000 people. And let's get even more specific. We just rolled out a program here for pelvic health. We had it in the past. The therapist retired. We couldn't find a new clinician to take over the program. That was probably 6 or 7 years ago. And now there's a new thing with the graduating DPTs. They want to do pelvic health, right? And find it very rewarding. So let's say we wanted to attract patients in. Who are the people who are most likely to come back in for pelvic health? The lowest hanging fruit is reactivations, right? So that is one channel, and I'm going to give you 5 here. Channels 2, 3, and 4 are all referrals, right? So we have referrals from partners. These are, for example, today we're doing a day of screenings at Fleet Feet, which is a specialty running store, and we have 10 or 12 spots, and Fleet Feet promotes us to their customer list, right? Or we could go to a large employer, like we have a relationship with Pepsi in our area, and Pepsi will promote us to their employees for both workers' comp and for injuries that are not workers' comp related. But you get the idea there. So this is somebody, an organization within our community who's promoting us. Gyms, boutique gyms specifically seem to work really well. Yoga studios, Pilates, et cetera, things along those lines. Physicians. So there are physicians, nurse practitioners, PAs, et cetera. You want to know your practice act and who can refer to you, but they could refer to you, right? And then we could also rely on friends and family. That's the word of mouth referral. And then finally, we have cold traffic. These are people who don't know, like, and trust us yet. We know just from looking at this statistically in our more established clinics, meaning they've been open for more than 3 years, reactivations are going to be more than 50%. When we're opening up a brand new clinic, most of our traffic is going to be cold in the beginning, right? So makes sense. But as a clinic matures, we're going to rely on those reactivations more and more. And if we were to predict who's most likely to come in next month in an established clinic like this Harrisburg clinic, it's going to be people who already know, like, and trust us. So why do we want to go there? Well, again, not only is it the lowest hanging fruit, we can get the best return for our marketing efforts, whether it's time, money, or resources. The other thing is, if you're in physical therapy, 10 years ago, we were talking about this, and when Breakthrough started here, and most of the market was not aware, but in 2018, January 2018, there was an article published in the Journal of General Internal Medicine. This was one of the graphics that was in that research publication. And what it showed is they took a look at back pain referrals to physical therapy. So if you're a physical therapist, this will hit home. And it shows a pretty steep decline in referrals to PTs from physicians from 2003 to 2014. In fact, it's a 53.6% decrease. I don't have the next graphic up, but I can tell you what happened. They also took a look at where the referrals were going. And while there was a 50% plus reduction in referrals to physical therapy, there was also a pretty steep increase, nearly 100% increase over that same time period of referrals to specialists, right? So, and the reason is pretty simple. If you're in conservative care, there is a lot less money in PT than there is referring to a specialist. So just realize this is out here. And I know I still talk with physical therapists once in a while who want to rely solely on physician referrals. You can do that. We find it to be very not fruitful. What is better is that we have systems and processes in place for a past patient list and also cold traffic. So marketing challenges that we're hearing in the marketplace right now, number one is inconsistent. The owner feels like they're on a roller coaster. I've done this myself, and before I understood marketing, this is what was happening, on a pretty much a daily, weekly, monthly basis. In the beginning, my original business plan was for 5 new patients a week. And I remember going home every night and Steph, my wife, would say to me, "Did you get your 5 yet this week? Like, do you have 5 new patients coming in?" So that inconsistency, right? And then what happens, especially if we have a smaller practice and we're the only provider, is we go out, we do some sort of marketing effort, we get an influx of patients, then we're busy treating, and our marketing effort goes down. And then we have to go back out and do that again. And we just keep riding the roller coaster up and down, up and down. Another challenge is no control, right? I don't feel like I can control this in any way. I don't know what to do to drive reactivations. I don't know what to do to drive people coming in from cold traffic. I don't know what to do to drive in referrals. Profit leak. And by the way, there was let me back up here for 1 second. If you get into studying medical and healthcare, the history of medical and healthcare, especially over the last 150 years, there's this idea that we shouldn't have to market, right? Very good friends with my dentist. I've been going there for 45 years since I was 2 years old, and just shook his hand at a baseball game last night, and we were talking. But I can remember very early on when I was graduating from PT school, he said, just provide high quality of care and you can rely on word of mouth referrals. You should never have to do marketing. And that actually comes from the 1860s. So that's been around for a while. It used to be within the AMA guidelines. And then in the early 1900s, that was taken away. But that thought process still exists. And so marry that up with most of us within our code of conduct, our professional code of conduct. For example, if you're a physical therapist, I know that it's 8A through 8D. We have a responsibility to educate the general public around our services, right? So we have input and we can hear these things saying, you shouldn't be doing any marketing at all. And then the other one is, you should be educating, right? To me, they're the same thing. Good marketing relies on patient education, positioning ourselves within the marketplace. So nonetheless, most of the time when I hear this, that I don't feel like I'm in control, and we talk about what that owner's doing, they're really not doing much, right? They're ascribing to the belief that they shouldn't have to market. And that's unfortunate because they probably can offer great services within the community, but enough people don't know about it. The next one is a profit leak. So number one profit leak within the country, in the industry right now, is underutilized schedules and underutilized space. For example, a year ago, we opened up a clinic in Lancaster. You might know Lancaster because it's very popular it's outside of Philadelphia. It's popular there's a huge Amish population there. So the underutilized space, we have a 3,000 square foot clinic. We now have 2 full-time clinicians. Their schedule's full. We're hiring a third, right? But until we get up to like 5 or 6, we have some space there that we're paying for each month that we're not really fully utilizing. Most practices that are struggling with profit, this is a dirty little secret. They really have that going on, right? Or the other one is underutilized schedules. You brought on that new clinician and they're not full yet, right? The game that we talk about repeatedly is we want to fill space and fill schedules with our marketing. When marketing is doing our job, then the schedules are full and the space is full. Fourth one is no control over the payer mix. Again, we can hedge our bet when we're doing reactivation. We can do it when we're working with partners. A quick, easy example there is, you should have a really good idea of who the top 20 employers are in your area that are offering the best insurance. So if you're participating with insurance that gets around, who's your best payer? You probably know who that is off the top of your head. So wouldn't it be absolutely amazing if 100% of the patients coming through that you were seeing were that payer, right? So that's the dream. What can you do to take a step there? We're going to talk about that here in a second. And then the other one is the slow season. I'm in the Northeast. Well, I'll ask you, do you have a slow season? The typical slow season here in the Northeast is from Thanksgiving through the end of the year. When's your slow season, JS? Yeah, so you can, Katrina says January through March. Yeah, so ours is Thanksgiving through the end of the year, and then we get a little blip in January as well when the deductibles reset. But would it not be great? So we used to lose a ton of money in November and December every year. And I kind of got sick of that. And eventually we learned, what would this look like? We asked ourselves the question, what would this look like if we were full and this was the busiest time of the year? And then what we had to do was really ramp up our marketing specifically to our past patient list right before that holiday season. And the first year we did it, we ended up creating a 7-week waiting list. So no sleep. Here's what some owners are saying. The first one is just recognition and acknowledgement. We're losing physicians. I remember here where I'm at in central Pennsylvania, we have 2 large hospital systems that now employ 90% plus of all the physicians in our area, and it's like 3,000 physicians. So pretty large population of people, lots of physicians. Most of them work for one of 2 hospital systems, and they're not really allowed to refer out. Just the reins were tightened over time, and we hit an all-time high back in 2008 of 154 physician referrals in a month. And we're nowhere near that today, even with 7 clinics. So we had to replace that elsewhere. Many other owners have gone through the same process over the last 10, 15 years. So the other one is, I wish more people knew what we could do. It's frustrating to hear patients talk about getting run through the mill before they make it to us. Pretty common pain point. And then the other one is, how can we possibly compete with the hospitals when they're getting paid 3 times the amount that we are? And they have built-in referrals. So what are most owners doing? Number one is cutting cost. I hear this a lot. Just heard it from another longtime practice owner that I worked with, just shrinking down to zero, the marketing budget and trying to cut cost across the business, and then thinking that they're going to grow and help more people. That's a very tough game to play. If you're going to cut dollars, most of the time you need to fill in that gap with time, a time investment. And most of us are time starved. Number 2 here is pulling back instead of leaning forward. One of my favorite books back when I was in college that I read pretty early was Rich Dad, Poor Dad by Robert Kiyosaki. In that book, he tells an analogy. I believe he was in the military in the Vietnam War, and he was a helicopter pilot. And he talks about when he went through the training, the very first thing that they taught is that when the helicopter gets hit, what most people do is they pull back. There's a reflexive pullback, save. If you're watching National Geographic and you see an injured animal, the first thing they do is that reflex of, protecting the injured limb. They withdraw the limb, they retract the limb. And he said, in flying a helicopter, when you do that, you die. Like, it's instant guarantee of death the second that you pull back. The only way that you can possibly survive when the helicopter gets hit is to lean forward. And he said it's so counterintuitive. It's the very first thing that they train in. And if they cannot train it in on somebody, that person does not become a helicopter pilot. It's very similar to what happens in private practice and, frankly, any business, right? So when times are tough, it's very easy just to pull back and we're going to cut everything across the board. And for most of us, the only way out, the only way to survive is to lean forward. Very counterintuitive. Won't spend too much time on that. Robert Kiyosaki does a great job of it, and he writes about it several times in his books. The other one is ignoring the low-hanging fruit. And there's lots of reasons that owners will say that they're doing this, but if you have a patient list, very easy to market to that, again, without a lot of effort. So let's talk about specifically pitfalls to texting. Number 1 is no list, not updated, not kept up with in any way. I see that way too often. 2 is no ability to segment, right? So if we were to run a reactivation campaign, and I'm going to give you a challenge here in another slide or 2, but if we were to run a reactivation campaign, would it not be nice if we first sent that reactivation campaign only to our highest payer? For example, my highest payer is one of the Blues, right? Would it not be great if I were doing 10 reactivations or sending out 10 messages today that it went to those people first? right? Would that not make sense? Because you can do that. 3 is poor or no follow-up. By the way, one of the common questions I get is, well, I don't take insurance. I'm out of network. I'm cash pay only. Fine. The abbreviation is called frequency, recency, money. So you can take a look at your list and segment not by insurance company if you're cash only, but you can segment by how often you see somebody, right? So somebody who you're seeing more frequently is more likely to come back in for a reactivation. You can do recency, right? Somebody you saw 6 months ago, much more likely to be reactivated than somebody you saw 6 years ago, right? And then the other one is money. So what's the amount of money they've invested in your services over time? Somebody who has spent $200 with you is going to be reactivated at a much lower rate than somebody who spent $2,000 with you or $20,000 with you or whatever it might be. So frequency, recency, money is another way you can segment if you're cash based. But most practices, they're just happy to have, some semblance of a list. Poor no follow-up is another one. So literally, I just saw this. I'm going to show you the system that we use. I was looking at one of the practices we work with, and they were talking about, we sent it out. There was a lot of responses, but nothing happened. Literally, I could go in with the practice's permission and see that they had no follow-up. They would ask a question and then just like turn it into small talk. And it was rough to see. So they just had, acres of diamonds. They were just literally inundated with potential patients and didn't know how to have that conversation. We're going to have a live one here in a second. Number 4 is list is not warm. A lot of clinicians afraid to send anything out to the list. They're afraid to have an unsubscribe. This is a little counterintuitive. I actually want the unsubscribe. So if I can, communicate with my patient list via direct mail, telephone, email, and text, and they're going to unsubscribe to my email list, that's okay. Maybe that's just saying they'd rather that I text them, or they'd rather I give them a phone call, or they'd rather use another form of media for communication. I'm fine with that, right? Because I want high deliverability in the end for each one of those lists. And yeah, just don't be afraid, right? Much better to have the reactivations than be worried about, 1 or 2 or 3 unsubscribes. Number 5 is not scalable, and I'll do a demonstration here for that. So the 10 text challenge, if you haven't taken any notes yet, now is the time you want to start doing this. And again, we'll have a handout here for you in a little bit. So number 1, this is how to do it. What do I do with text? And especially if you've never done this before. Number 1 is you need a list, right? So the most very smart person once said, the most valuable asset in your practice is your patient list when you know how to use it, right? So just having the list and not doing anything with it, not communicating to it in any way, not really valuable. It's extremely valuable, can be extremely valuable when you know how to use it. So get your list together. There are different segments. You could think about your best payers. If I'm going to pick 10 names out of 20,000 or whatever our patient list is at today, 33,000, something like that, I'm going to go for the best payers first, right? We can't afford, our lowest payer is less than $70 a visit. It would be insane to think I'm only going to reactivate people that are our lowest payers, right? That would make zero sense at all. At the same time, if we can hedge our efforts, we're going to reactivate the best payers first. And you have that information. It's in your EMR. So best payer or willingness to pay if you're cash based. I gave you the frequency, recency, money there. I would target, you haven't seen them in 6 months to 2 years. Like that's the sweet spot. Yes, you could go sooner. Yes, you could go longer. I would focus here first. And then you might want to think about diagnosis. So very rarely, if you want to quickly be in the top 5% of owners in terms of being sharp with your marketing efforts, just think about diagnosis. For example, BPPV. We have had Sue Whitney, leading researcher in the world. She lives in Pittsburgh. She has a sister that lives close to us here. Every couple of years, Sue will come out and train our therapist in how to treat BPPV. when we look at the plan of care value, it's somewhere right around $300. We see the person for an eval and a few visits, typically clears up, and unless they have a VOR, vestibular ocular reflex deficit, we're not going to see them for any length of care at all, and the person feels better, they got the result, they met their goals, but now they're out the door. That's not super valuable to us. And literally when we break it down, it's a break even the majority of the time. So I'm not going to do a lot. If, we saw somebody for BPPV, I'm not going to invest a lot of energy around reactivating that person. They do get communication, but just think about, what is a plan of care worth? What has a higher value to you? Shoulder pain or a person who has a balance and dizziness issue, right? Or is it pelvic floor? Or is it some other diagnosis? And you can apply this pretty quickly to whatever specialty industry you're in. The second thing we want to do, so number one is we have our list, right? And I'll go back to that market message media match. You likely have heard me talk about that in the past, but we want a very simple message in this text. Here's a sample. Hi, Lauren. This is Chad Madden from Madden Gilbert PT. It's been 6 months since I last saw you for your neck. How are you doing? Right. Very, very simple. It matches how texting is used. It is not an over-the-top message. I'm not sending her a book, right? This is 3 sentences, very quick and easy. And it asks some form of how are you, right? So how are you doing? That's my Central Pennsylvania coming out. Very, very simple. We send this out. This specific message gets on a warm list, will have an 80% plus response rate. So that just quick bar for you to, if you're providing high quality of care and relying on word of mouth referrals, the bar is 8 out of 10 people should respond within a day. I've had 9 out of 10 within 1 hour already. So just putting that out there for you if you're looking for something to aim for. The third thing is they're going to respond back. The worst thing that you can do is ignore it, right? Like, don't do anything with it. There's really 2 things that they can say. One is they're doing great. And then we'll always ask some form of what else, or is there anything else going on, right? Your neck's great, but Lauren responds back and she said, my neck's doing great. And then we can always say, oh, do you have anything else going on? Anything else bothering you? Something like that. The other one, if she's doing not so great, we want to use something called deference questions where we're deferring to the patient. And by the way, I'm going to give you a pop quiz here in a second on this. So this is something that you want to pay attention to. So, those questions typically start with how or what. I got this idea from Chris Voss, who wrote Never Split the Difference. It's an amazing book. If you're a business owner, I would pick it up. I would have it in one of my top 10 books. I mean, it's probably within my top 10 all time of business books recommended. It's amazing. But this concept came from an FBI negotiation that he was doing on a hostage, actually in Pittsburgh, Pennsylvania, another Pittsburgh reference there. And it was a drug dealer who had kidnapped the girlfriend of another drug dealer. They were struggling with this. Out of the blue, he was on a phone call with this other guy, and he said, the kidnapper, and he said, how do I even know she's alive? And the other guy responded, and they came up with this idea around deference questions, and they work really, really well. You and I don't have the pressure of running an FBI hostage negotiation, but we can still use these. By the way, they work really well in relationships as well. I use them a lot, and every once in a while, my wife will say, hey, are you using something out of that book? And I'll sheepishly say, yes, do what I just did here and blush. But, we can ask questions like, what's going on? How long has that been going on for? What have you tried so far for treatment? What's your pain stopping you from doing? By the way, that's the number one question you want to get to. And how's it affecting you? Notice what I didn't say, right? Oh, I'm certified and, I didn't do anything like that, right? Or trying to justify an appointment or whatever it is. Like I'm focused on the person. There's a lot of power in these questions. I would master using these questions in your response, right? I'm asking a question. I'm not telling them what to do or sending them exercises or anything like that, or a research article, which is the worst one. All right, so we want to respond. So the 10 text challenge, here's what you're going to do. You're going to pick 10 patients from your past patient list. I don't care what diagnosis it was. That should be what it's going to be. That's your decision. I don't care what payer mix or payer that they have. That's really a decision that you have. That's up to you. Again, I would go for the lowest hanging fruit that is the most valuable to my practice. And I would think through those variables. And I can't control every single one of them, but I can absolutely hedge my efforts in the right direction. You want to send them some form of a personal, how are you message, right? And then you're going to respond back with deference questions where you're deferring your power, right? And then pretty simple. I can do 10 in under 15 minutes, and each one is personal. So complete 10 in less than 60 minutes is the challenge. And then measure your results. So if you send 10 out, you want at least 8 to respond. For those that have pain, you should have nearly 100% reactivation to an appointment when you stick with deference questions. So that's the challenge. So some quick wins here. Steve Edwards, Lisa, they posted in our Inside Circle group, which is our community of 400, 500 owners sharing exactly what they're doing in their practice to get wins. You can read those pretty quick. We filled 90% of the available spots in less than 2 hours from Steve. 40 people wanted a free 15-minute screening gift, and today we converted some of those persons for PT or cash fitness visits. Very cool from Lisa. All right, so at this time, we are going to put, it's in the chat right now, there is a link for a handout for the 10-text challenge. Take that. This is something you could do today if you're at the office before you go home tonight. Very quick and easy to implement. I mean, we do that. So something else I want to say, if you have more than one clinician, whenever your clinician is not busy, this is something they can be doing to contribute to the marketing, just reaching out to past patients. Just think about how unique it is in the marketplace. How many times has your dentist, your family doctor, your fill in the blank healthcare practitioner reached out to you and asked you how you were doing? Probably doesn't happen a whole lot. Maybe never in your life, right? And or if it comes through, it's something that's very apparently not personal, right? It's something in mass, they're trying out something. This is something that you can do, show you how valuable you are in the marketplace, and you're going to get reactivations from this, or at least I challenge you to. So link in the chat, you can take that with you. Make sure you grab that right now, download that, earmark it. And then I want to show you a live example here. Hopefully I can exit out of this. And all right, so have this one up already. Did this morning. Everybody can see my screen. There's a chat. I can't see what my screen looks like, but yep. Okay, great. So, and can I zoom in on this? All right, so this is, I sent out my message. By the way, this is our breakthrough platform. This is where we run everything through for our cold traffic marketing and our partners. And we just keep track of everything in here. And so Lauren, by the way, I know Lauren, she is not a patient, so I'm not violating HIPAA in any way. Disclaimer there for you. So hi, Lauren, this is Chad from Madden Gilbert PT. So it's been about 6 months since you were last in for your neck. How are you? She responded, I'm okay. My neck has been giving me trouble again. So what would you write next? Go to the chat. Tell me, this is your pop quiz. How should I respond to this? My neck has been giving me trouble again. What would you write? For how long? What have you tried? What happened? David says, sorry to hear that. Actually, we have 2 sorry to hear that. Sounds like we need to get you back in for a follow-up. How long has it bothered and what does it feel like? From Scott, how long? Sorry to hear that. How long has that been going on? All right, so how long is by far the most? And we'll see if Lauren responds. About 2 weeks. Okay, great. Woke up and it's been, by the way, you really have this going on right now, right?
Oh yeah, I've been trying to get it solved this week, hopefully before boot camp.
Yeah, or we can solve it here.
Sounds good.
Yeah, woke up and it's been real limited, range of motion and stabby. All right, then I would go through, what have you tried? Now the key is, and here's something that I did not have in the presentation, seems like, sounds like. So the conversion over to scheduling an appointment, and I know you had something in there, Rodney, around give us a call for an appointment. Sounds like you might need help here, right? Something like that works really well. So it seems like, sounds like, there's no I in it or we in it or anything like that. But I would go through, everybody did a great job with the questions. So we're responding in that way, how or what. This is what I used to ask all the time from YouTube. When can you make it in? Very, very simple. Rodney asked, why not just say, can I schedule you for an appointment? You can try that, Rodney. I mean, we've tested a couple thousand different responses. I find that does not work well. Yeah. So never say I, always say this is the minutia. But if you're like really thinking about for the rest of your practicing career, maximizing conversions of people coming in for appointments, the very specific words you say, it's important. So what are how questions, the deference questions, the next layer is going to be something along a seems like, sounds like, and then when can you make it in, right? I have a Tuesday morning, 8:30, something like that. So now here's the next challenge. Go through the 10 text. You could do that today. Now, the next level up is sending it out to 1,000. So we've just done this. And you saw the results from Lisa and also Steve. This can work really well. The key is you want it to feel personal for the person, but you want it to be scalable, right? Especially if you're trying to fill a lot of schedule, a lot of space, and you're looking for a lot of responses. I can tell you, we have had over 200 responses in one day, which is quite a bit to manage. So, we have a marketing team that does this, but here at my practice, but that's, if you want to scale up and you want it to be consistent long-term, you need some tools in place, right? You need tools to be able to track and manage everything as these are going out, and for most of us, you get 5 or 10 of these going out every single day for each clinician. You're going to be having more than enough responses to get back to, and you're going to be able to keep your schedules and your space full. In the end, what would this mean for your practice? If you developed a sense of control, you had a marketing system in place where it allowed you to focus more time on building your business, building better processes, building better systems so that you could grow and serve more people. We're not out in the community and we're not helping that person with conservative care. What are their other options? We're saving people from more opioids, more painkillers, more pain medications, and much of it is unnecessary. We're saving them from expensive additional diagnostic imaging that they may or may not need. The research isn't great on that. Many times we're saving them from another injection or a surgery or something like that. That is the thing that always brings me back. And I think you're most likely a purpose-driven, mission-based person. In the end, that's what we're working for. If we have any time left here, happy to answer any other questions that you may have. Luke asked, does your software replace things like Aweber, Keep, and Go High Level? The quick, easy answer is yes. Yeah, I've used Keep and I've gone through Infusionsoft. We had won awards there, but probably turned that off 7 years ago now. And we run everything for our entire practice through Breakthrough. So, well, think about this. Look, you can be full-time marketer and build out all the campaigns, everything else. Breakthrough has all of that done. So the do-it-yourselfer who is just in love with staying up late at night to crank out those programs, perfect. The owner that wants everything done, the campaigns figured out that are preloaded, where they just click a button and the campaign goes out on the set date that they set, that's what Breakthrough's for. The other question that we commonly get is, is it integrated with my EMR? We know the largest EMRs right now, we do not have it integrated with the EMR that we use, but it's something that Carl's always been working on. Appreciate every one of you for what you're doing in the community, helping people overcome their health challenges naturally. Thank you very much. This has been great. Again, thank you for your high engagement in the work that you're doing. See everybody.
What would adding $10,000 to your bottom line do for your practice? Let me show you how with our program, Profitability Under Pressure. Hi, I'm Chad Madden, and I'm assuming that you're a private practice owner wrestling with profits, revenue per visit, hiring, and in the end, you want to help more people. I'm here with some exciting news for clinic owners just like you. You don't want to miss this. This course is a game changer. It's helped clinic owners add big numbers to their earnings. People like Joe and Kathy Scarpito, who doubled their clinic's value in under a year. Tony and Melissa Sear, they grew their practice from less than $1 million in revenue to over $3 million each year. Now, you might be thinking, is this all about money? No, it's much more. It's about taking care of your team, your patients, and your family. It's about making your clinic the best it can be. Let's face it, money in private practice isn't growing like it should. But don't worry, that's where our course comes in. In just 3 months, Profitability Under Pressure will teach you important business skills, like how to make more effective use of your space, how to increase your lifetime patient value and improve your payer mix. There's even a special part on hiring and retaining great staff. Joining means that you're not alone. You'll be part of a group of clinic owners, all working to get better. We'll be right there to help you. Are you wondering if this is right for you? Let's find out together. Apply to Profitability Under Pressure. It's easy. There's no pressure, and it's all about your clinic and your practice. We have an upcoming deadline, May 17th at midnight. When you apply to Profitability Under Pressure, you'll unlock valuable bonus content. The Ultimate Reimbursement Renegotiation Bundle, how to hire and incentivize staff, the direct-to-consumer marketing course, and the Zero to Profitable de novo training. This is for you if you're going to open a new location. To qualify, you must apply by May 17th. The program comes with a $10,000 guarantee. We guarantee that when you implement the strategies in the course, you'll increase your profit by $10,000 or more in 90 days, or your money back. Now's the time to make your clinic stronger, for you, your team, and your patients. Click below to apply.